So Pfizer is completely 100% committed to India. Our expansion takes different forms, starting with R&D, where we are continuously expanding. We have almost about 1,500 people in Chennai, largely in our R&D organization, including one center at the IIT-Madras Research Park, where we are just expanding our capacity 50%. The second is manufacturing. Almost 70% of what we sell in India, we make in India, either with our own plant in Goa or also through contract partners, almost 18 partners around the country. We also have an only export oriented unit for sterile injectables, the only one in Asia actually, out of Visakhapatnam. So manufacturing is the other area where we are continuously expanding. Goa, we are seeing some expansion. We are trying to bring more products to be manufactured in India. We are just in the middle of shifting a lot of our oncology chemotherapy products from Australia to Gujarat. So that whole, it's continuous cycle. And then last but not least, in the commercial organization, of course, with our medicines, we are trying to reach more patients. But in addition, we've also started establishing pockets of global capability centers. We just recently launched an analytics center for 80 people based out of Mumbai. And there's a lot more to come in that space. So I think if you look across our business system, each piece is expanding in its own way. As a result, the whole entity is definitely, expanding its commitment to our country.
Ma'am, Pfizer is working towards adult vaccination also in India?
Yes, we already have one product in the pneumococcal space for adult vaccination. And that is something that we are, very heavily invested in, and we're looking to bring more and more adult vaccinations into the country. Adult vaccination is very different from pediatric. In pediatric, you've got the whole ecosystem that works. In adult, it's not just about having the best product, but it's also about building that ecosystem where the doctors are, feeling that it's worth prescribing, having the right guidelines, creating the patient awareness, ensuring the distribution is correct at the right temperatures. So we are working towards all of that. We are already in the pneumococcal space with adult vaccination and looking to continue to bring more products into the country.
Other products related to the vaccine, ma'am?
Right now we are working in pneumococcal, where we do plan to bring advancements continuously, and we're always looking to bring more vaccines. It requires a certain regulatory process, including clinical studies. So we are just evaluating how we start that off before we can launch it.